The Syrian refugee crisis is the worst humanitarian disaster of our lifetime. The UN says that more than 650,000 people have fled the war in Syria and come to Jordan. More than half of them are children.
We should have faith in humanity, and I think Jordan is a place that gives you this hope. Welcome to Jordan.
About 18 Atlantic Fellows have come together to be part of a Displacement Forum. We're going to be exploring issues related to the health of refugees. We're at one of the oldest houses in the neighborhood, trying to feel the spirit of the space and place we're in, and trying to understand that this land was a passage of so many civilizations.
Tala, being Jordanian and with her work centered in the refugee camps in Jordan, has been able to work with us to create a week in which the conversations of the fellows and the work of the fellows is really strongly located in place.
To our beautiful senior fellows, that's what it's all about. Imagining what is possible when we act together, when we connect together, when we lift our heads above the incredible work that we're already doing in our communities and think about what's possible and make the impossible possible.
I would like to understand the experiences of refugees from Syria in Jordan, because I'm also an immigrant in South Africa. I was born in Zimbabwe.
These convenings of fellows coming across from different programs, coming together and trying to develop that shared purpose, you do think and you do reflect.
Anything that gives us as human beings, as physicians, the ability to be more empathetic makes us better care providers.
Is it a goal of folks, assimilation, or is there still hopes of going back home?
I can take back the experiences to the South African context in terms of what we're experiencing in terms of the refugees and asylum seekers.
I treat and have treated undocumented immigrants and refugees for many years, and I've heard their stories, their trauma, and I've really wanted to find a way to learn more about the refugee crisis and be a better advocate for my patients.
My hope is to listen well, to observe well in a way that helps me understand my place and the type of contribution I can make.
How to combat global inequality.
The framing of the forum was underpinned by an approach that the Institute has with regards to co-design and connecting our fellows across diversity, a breadth and depth of diversity that is unprecedented in any global fellowship program.
We here in Amman and at the UNHCR registration office, which we were told is one of the largest registration offices for refugees in the world. The thing that strikes you is how enormous the problem is. There's so many babies and young children, and they're struggling to survive.
We are now at Zatari. It's the second largest refugee camp in the Middle East.
First of all, I want to say you are welcome. My name is Asma. I'm 13 years old. I would like to be a businesswoman in the future.
And the largest refugee camp for Syrians worldwide.
We still do that.
We had this incredible gift to meet with Syrian refugee students who were quite far along in their university studies here in Jordan, but an initial donor was unable to complete his gift, and they were left without their final year of funding.
All of us, we came from the war. We don't have houses, we don't have cars, we don't have jobs. We lost everything already. We start from zero.
We had a rather joyous occasion to share cooking a Syrian meal with them, which was a beautiful experience. They were joyous people who maybe were laughing through their tears. We've chosen to pursue completing the scholarships for these students because of who they are.
So part of my work has been to bring this effort to a conclusion.
Have a gift to check.
It's okay.
We are promise him we will studying hard, we will working hard to be able in one day be able to give like this choice to other students to complete him their university and to help other students.
I think these students do represent some of the qualities we seek in Atlantic Fellows: resiliency, courage, a commitment to keep going even in the face of adversity and complex problems.
I read about him. He is amazing.
I think the group has created an environment that is very reflective, that is very empathic, that is very curious, that's enabled some amazing conversations and connections to happen that are now translating into joint work.
People can forget what you say, but they'll never forget how you made them feel.
I'm kind of still connecting and digesting and decoding.
The world is changing so fast. We need to have a common narrative.
I believe that art transforms human thoughts.
A forum like this, where it's deeply experiential, where fellows thinking about displacement and the effects on health might be challenged or changed, it takes time. It takes time for fellows to deeply reflect and then think about doing things differently.